Welcome to Boston Children's Answers Parentcast. I'm your host, Jennifer Arnold. As a doctor and a mom, I'm passionate about helping kids stay happy and healthy. So join me as I chat with other Boston children's experts to find answers for you and your family. Hey everyone, welcome back. In today's episode, we are talking about, yes, your favorite topic, the teenage years. Well, I remember when I was a new parent, everyone said to me, little kids, little problems, big kids, bigger problems. Well, I kind of at that time thought, what could be worse than not sleeping at night and changing dirty diapers and worrying about where my kids were running off to? Well, I can tell you that kind of, in essence, they were right. As your kids get older, the problems do get bigger. And I'm excited today that we have an expert to help us talk about how to provide the best health possible for our teens, our adolescents. But as always, let's start off first with our parent question.
Hi, I'm Heidi. My son Matt is 14, and I feel like he's become a different person. The little boy who wouldn't leave my side only offers grunts now when I ask how his day was. He's so secretive. Should I be worried? Should I ask his doctor? He's too young for an adult doctor, but should this boy man still be seeing a pediatrician?
Thank you so much, Heidi. I totally get it. The teen years are no joke, and I'm living it right now. Even though our pediatricians can care for kids of all ages, occasionally our kids might need a little extra care from those that specialize in those adolescent health issues. So today we're going to help answer some of those questions by talking to a specialist in adolescent medicine. Here to discuss this important topic with us today is Dr. Pamela Murray, an attending physician at Boston Children's Hospital's Division of Adolescent and Young Adult Medicine. Thank you so much, Dr. Murray. It's so good to see you.
Great to see you.
Oh my goodness, I'm so excited to chat with you today. Thank you for coming and talking about this topic. We kind of go way back to my training days in Pittsburgh.
Yes, those were pretty special days.
Very special days. Yeah. And I got to work with you, and I almost went into adolescent medicine.
I was very aware of that.
And I loved it. And sometimes I wonder, why didn't I do that? But that's okay. I'm getting a crash course today with you today since I have two adolescents in my home.
Yeah.
So maybe we should start off by asking for our audience, or so that they know, what is adolescent medicine?
Well, lots of people ask that question because most specialties in pediatrics focus on one organ system or another, and adolescent medicine is more developmental and integrative. So we look at a lot of issues about like the body and the mind and reproductive health care. So we have some overlap with our colleagues in psychiatry, gynecology, endocrinology, and then we also, many places do a mix of some primary care, but are also available to our colleagues for consultative care, where you need extra help from, other specialists. We do, that's probably the majority of our work.
It's so important to really think about the unique needs of patients in this population, in this age group, because there's a lot of, I think, changes that happen to kids as they progress into adolescence.
Yeah, and we can see, some young people who are in their early teens.
Okay.
Sometimes for some referral care, particularly young girls when they've first gotten a period, if it's a problem period. So those are sometimes 8 and 9-year-olds. Most of our new patients are kind of 18 and under, but we do see a lot of folks who have established with us before who are in their early 20s.
That's really great. Well, I like to ask every guest that we have here why they chose the specialty that they chose. What inspired you to go into adolescent medicine?
I think it was a combination of circumstances, interests. The things that I liked a lot included psychiatry, endocrinology, kind of OBGYN, and I ended up doing some pediatric electives that I really enjoyed. And I also like that there are underpinnings in pediatrics that were really about prevention, both short-term and long term and kind of even some social justice values that sometimes were as important as the disease. I liked the way all those pieces came together. And then probably beyond my expectations, I really enjoyed and learned so much during my pediatrics residency. The other thread was that I had a lot of friends in high school who really struggled with mental health, substance use, kind of reproductive health, where you could get birth control, what happened if you got pregnant, and there really weren't many accessible or safe options. I think in residency, I really saw the interface of like mental health care and physical health care, and that appealed greatly. And I felt like I just found my spot.
It brought together
Yeah.
all the things that you love.
Yeah.
You really influenced me, and I thought really hard about adolescent medicine for a lot of the same reasons. Just getting to be close to those patients. As a specialist in that area, you can really help kids go through that phase of their life and keep them healthy, but also attend to what I love to hear you say is the mental health and the physical health and how important those are together in that age at that time. And today we're talking about this more and more and how important it is. So I think adolescent medicine is really important for our future. Can you tell me how it started as a field?
Many of the early people in adolescent medicine were actually internists who
Interesting.
kind of focused their interest on teenagers and teenage health. So I think there was a big unclaimed area of expertise. But anyway, people here and subsequently several other places created this specialty. In my career in adolescent medicine, we've gone from, okay, you can have a fellowship, put together a one-year training experience, make sure you do a good job for you and for other people, to now having a very formalized training, just like you were becoming any other kind of pediatric specialist. And those are all 3-year training programs.
Reminds us how so many specialties, right, started off as sort of someone identifies a need to really know more and be able to focus in on the care of patients with a particular area or focus, and it may have started as a 1-year non-accredited type of program, and then all of a sudden you realize that there's a specialty here, and so you get into those longer training programs.
Right.
Well, that's where we're at too with healthcare simulation. I think it's now there's just evolving fellowships. They're 1 year, they're not accredited. I wouldn't be surprised if in the future it's a real formalized field. Who knows? You never know, because when you identify the need and the expertise needed, then just thinking about this whole field, what are some of the unique differences from a care perspective between adolescent medicine and general pediatrics?
So some of it is the extra knowledge that people come in with. I think we often have a willingness to try to manage multiple problems at one time. We often have the privilege of having longer visits with patients. It's incredibly rewarding.
Yeah. Oh, yeah. That's why I fell in love with it. I saw the patients that you impacted and how big of a difference it made into their trajectory as, you know.
And I often say if I only had 10 or 12 or 15 minutes for a visit, I couldn't do the things I do. And sometimes people will say, well, why didn't my doctor figure that out? I said, because I just spent an hour and a half with you. Yes. And then I went home and thought about it for another hour and talked to 3 of my colleagues, because some problems are hard.
Yeah. So it's really a very expert level of care that, sounds like maybe a general pediatrician doesn't have the time built in. They're not able to spend with every patient.
Right. I think the amount of time and how we manage that time, like I said, and I look at it as sort of a privilege, but, not all healthcare is going to get delivered that way. And not every problem needs that amount of time.
Correct. Yeah. So, interesting.
I think general pediatricians still create sort of the backbone of sort of the trajectory of growth and development, lots of acute illnesses, injuries. They get to know families really well. And, in adolescent medicine, we often try to spend time talking directly with the adolescent, but I always think of most visits are 3 visits. There's talking to the young adult, there's talking to the parent alone, and then there's seeing them together for a while. And sort of depending on the problem, the personality, the age, the development, sometimes we spend most of the time with the teenager, young adult alone, and sometimes the parent still is the one who's sharing most of the story, but ideally you always want to have at least a couple of minutes with each one alone to say, is there anything else? Do you have any other questions? It's information that doesn't always come out with everyone in the room.
It's also really helping to prepare that adolescent or young adult to be independent in their medical care,
Right.
I imagine, because you sort of got the parents to be able to help with some things if needed, but you're really giving the adolescent an opportunity to share their own health needs and perspective.
I think the adult care system is often not as touchy-feely, so it can be tough.
Absolutely.
Yeah.
And it's sort of like, adolescent medicine, it provides that training wheel, so to speak, as you're transitioning to adulthood.
That's
for,
a great way
for
of
kids.
putting it.
Yeah.
Yeah.
As becoming, sort of independent and creating autonomy for their own health care. It's really comprehensive and kind of may cover some other health topics that may not be as commonplace in pediatrics.
Right. A lot of patients who are referred to us are because there's concern about an eating disorder and needed treatment, or they have menstrual problems or basic reproductive health needs. They need contraception, they may have STIs, people in
which are sexually transmitted infections,
right? And so all those things are kind of in the adolescent medicine toolbox.
That's great.
And kind of our other, product, right, is also seeing a lot of kids who have, I think, what we've been calling kind of chronic fatigue, who may have chronic fatigue syndrome. There's kind of a new umbrella called infection-associated chronic symptoms. So that may include like chronic Lyme. Some people even include multiple sclerosis. Now, we're not neurologists, but
Sure.
people who go on to have kind of multi-system symptoms that aren't easily, categorized or treated. Adolescent medicine is a home for people who have some of those interests as well.
What I'm hearing you saying is, it's like you've got the background of pediatrics, but many patients still see their pediatrician for that preventative care, visits, checkups, acute illness. But for some of these healthcare needs that are really kind of unique to the adolescent population, you're able to spend that time needed. You have the expertise, where I imagine as a general pediatrician, if you don't see a lot of those complex issues, you may not be as comfortable and even have the time to be able to sort those out.
And again, I think every pediatric practice will say this is a really big issue, but a lot of kids who have anxiety and depression that are sort of becoming more problematic, we have the ability to help make diagnosis. We have the ability to prescribe certain medications that people are comfortable with. I like to tell my patients that therapy is also important. And while I may be therapeutic, if I'm doing my job well, I am not a therapist. So, that's a different skill set.
Yep.
But, we can work together with therapists. I think if you have episodes of, psychosis where you really kind of are not in touch with reality, or you're worried about like bipolar disorder or OCD, like you need a psychiatrist to help you. We want to try to help people kind of live their best lives.
Yeah, that's what it's all about. All of these health issues are things that I would imagine many parents are worried about for their kids, especially in the adolescence phase. What are some of the health issues that you see most and help teenagers with?
Substance use, access to opioids, and the incredible consequences on individuals and families. But not forgetting that alcohol use, abuse is still probably the number one.
Oh, wow.
Right? I mean,
yeah, it's the most available, right?
Right. And, and there's been a huge increase in the use of marijuana in its various forms. And I think some new concerning evidence about some of its long-term consequences, and also seeing people with some short-term consequences, because as it became both legal in some ways, and there's huge state-to-state variation. When people are asked, well, do you think this is a harmful substance? People's concerns about its dangers, decreased. And so people who would say, well, I wouldn't touch nicotine because that killed my grandfather, now say, but it's okay to smoke weed because I vape instead. So people don't want to believe the things that are coming out. There's reason to have a lot of caution, but also to understand that lots of teenagers, young adults, and even adults still use some substances as part of their kind of routines, but they're not without some dangers.
Well, and even those health topics are so important for that individual's life that I think, I don't know, just as a parent, it would make me feel reassured that someone can talk about these things with the evidence, with the knowledge, and help my adolescent with that.
I remember doing some training and said to somebody that whatever you do at your visit, you want to make sure there's a reason for them to come back, right? Because you're not going to fix most things in one visit. I mean, you can take care of a strep throat or an ear infection, but it's about building a relationship, and hopefully, if there are other issues, building up the trust to discuss and then kind of make a plan together. And so, it's that harm reduction journey. Right?
And that relationship and trust, like you said, which is, I'm noticing now with my teenagers, is so important. If I can build that trust, they're more likely to open up to me, and then we can get at those difficult conversations.
Right. And we all make some mistakes, but you just don't want to blow up all your bridges.
So having that trust with for our teens in their physician allows them to get hopefully better care and, like you said, harm reduction. So Dr. Murray, you've talked a lot about all the different types of health needs. Is there something unique about how you treat patients in adolescent medicine?
For me, I start with who lives in the household.
Yep.
And we often learn about pets before we get anything else, but it lets you know that that's really important, right?
To that individual. Yeah.
And if you think, there should be other parents, and they weren't mentioned, you'll ask about them. We want to know education, where do you go to school? What do you like? There's for almost everyone, there's something that they're okay to talk about. So it's also exploring, where can I find some common ground? And then I want to know, well, what do you do for fun, activities?
Yeah.
Structured, unstructured. If you say, I'm in my room all the time, right? And, and you say, well, what do you do when you're in your room? What activities? And then sort of the D would be about drugs. So, I often start so much not with you do, what do your friends do? Because that's a little easier way to get some information.
Yep.
Or how about kids in your school? What drugs are there? Or how about your parents? And then I'll say, well, how about caffeine? Start with sort of things that I use a lot of, right?
Yes, me too.
We go from caffeine to nicotine to other vaping, and then asking about mood and kind of sex, sexuality, pregnancy prevention, and then safety. Do you feel safe at home, school, neighborhood, any worries? And then do you wear seatbelts?
Mm-hmm,
Because car accidents still kill and do serious damage to so many people.
I wonder if gun safety comes up.
Yes, so that is a very important question.
Yeah.
How many do you have? How are they kept? So you would go through that line of safety issues.
Yeah.
My job is to make sure people were safe. And when people were sort of depressed or had mental health issues, it was a concern because access to guns is such a huge risk factor for death from suicide.
Guns, yeah.
So,
so that's, I mean, these are pretty critical but tough topics. And, it's so important, though, to make sure to keep our kids, our adolescents and young adults healthy. And it just makes me wonder as a parent, like, how do I decide whether or not I should see an adolescent medicine doctor for my kids?
Just like if you needed to see a cardiologist or an allergist, there's a certain question and a problem you want some help with. And, so those are the reproductive health issues, STI pregnancy prevention, menstrual disorders, and that whole range of things. A lot of people come for eating disorders or other concerns with weight management, some people with obesity and other medical comorbidities. So we have programs that help, use some multidisciplinary approaches to those problems. We also see kids who have there's a concern about chronic fatigue. There's a problematic media use group. So you can get channeled into any one of those programs.
It sounds like you have like this multidisciplinary team that's all so knowledgeable and tuned in to adolescents and young adults and how they think and the health issues that are specific to them. Should I look to adolescent medicine for my kids now that they're adolescents? And what about other parents who are considering this?
I think lots of pediatricians are great at taking care of adolescents. On the other hand, there are some people who, I think because of their kind of constellation of sort of needs and preferences, want to give it a try. Because sometimes we do have people say, I really want to come to children's, but I really ask people to think about the logistics.
Yeah, the practicality.
Of that, because our specialty care is something that, you can't get that many other places. We want to make sure we can accommodate those patients who need our specialty services. And some people think nobody listens better, and other people say, I don't have the time.
Yeah.
No, so it's different. It is so individual.
Yeah. It's tough. I guess what I'm wondering too is, like, I'm thinking about, like, for families that are considering adolescent medicine,
right?
How you mentioned you're based at the main campus,
right?
If parents are thinking about adolescent medicine, care for their kids, where are they typically?
Our only primary care site is in, the main hospital in Boston. We provide, the specialty care in all the satellites. So, you can find those closer to your home.
Yep.
But there are states that have 0 adolescent medicine providers.
So they're not available everywhere.
No. So we are a very rich resource here.
Wow. So it sounds like there's a need for any listeners out there who want to go into adolescent medicine?
There's a huge need. So the numbers are still small, and while they're growing, they're not growing as fast as the needs are.
Yeah. If I'm, a parent, my child's turning 13, and I'm thinking, oh, maybe I should seek adolescent medicine care specialist for them. What advice do you give parents who are trying to make that decision?
Right. So first I'll say that every pediatrician, as part of their training, as you had, has a mandatory rotation in adolescent medicine. So, hopefully your pediatrician should be able to take care of most all the needs of your adolescents, unless there are some special problems that come up that really, we're available for them to ask questions. Parents come with their kids sometimes because they want some additional consultation, or because pediatricians have identified a problem where they think, well, we could all use some more help.
Yeah, with those complex patients, right. And if it's going well, then maybe you don't need that.
Right. So, so I think for most all adolescents, continuing their care with their pediatrician is, probably the best place to be.
Yeah.
Until other things are needed or wanted, if ever, right?
If ever, yeah.
Right?
Like if they have one of these health issues that are very complex or unique to that to that population, then maybe that's a consideration.
Yeah.
Makes sense. And talk to your pediatrician about it, because they'll probably be able to help you make that decision. So knowing that the field of adolescent medicine is kind of relatively new, it's kind of in its adolescence, maybe.
Yeah.
No pun intended, but
no, truly. Yeah.
In thinking about all the research opportunities, what do you see as the areas of either current focus or future focus from a research perspective in adolescent medicine?
Okay. So in our division, there's a lot of people and a lot of teams who are doing research, often on the areas where we provide a lot of clinical care. So.
Okay.
Lots of different groups within the eating disorders world, looking at different aspects of what's the best way to treat eating disorders, what are the best outcomes, when can we say that you're healthy,
Yep.
People looking at managing different mental health problems. Polycystic ovarian syndrome, or PCOS, is another very common kind of reproductive hormonal problem that we often discover in adolescence, so different ways of treating that. Endometriosis is another gynecologic problem that people in adolescent medicine with our gynecology colleagues are doing work trying to better both diagnose and treat that disorder, as well as support people who have it. There's a group that's looking at problematic interactive media use and what's the best way to, help young people. There are a couple of projects that look at kind of bone density. And then there are also some who look at like large databases of information, understanding kind of what events in adolescence, what effects they have on like adult health.
Yep. As we near the end here of our conversation, we have talked about so many important things related to adolescent medicine, and there's a lot going on in our own division. Is there anything that we haven't talked about yet that you want to make sure we bring up for our audience?
I think you've asked so many good questions that I feel like we've covered most everything. Although probably when I leave, I'll think of something else. Right?
That always happens.
Yeah,
Me too.
Yeah.
Well, perfect. Well, then I think it's time for doctor's orders, Dr. Murray. So this is the part of the show where we ask you to share an action that parents can do to help them raise healthy and happy kids, or in this case, adolescents and young adults.
So I think as parents, and I've sort of been there, we always think we need help when our kids are teenagers. But that doesn't mean you're not doing a good job. If you do think you need help, then ask. And I think sometimes people feel embarrassed or that they'll be judged, but One, probably lots of people have had that question before. And if they didn't, then there's something for everybody to learn. But the other thing I tell people is that if you really want to know what's going on, drive your kids around with some friends in the back seat and keep your mouth shut and your ears open.
Such good advice. I'm doing that.
Yeah, right.
Today.
Sometimes it's reason to keep them involved in activities.
That's where you get your intel.
Yeah.
Well, thank you, Dr. Murray. This has been such
You're
a
welcome.
fun conversation.
I know.
Good to see you.
Thanks. Great to see you.
Thanks so much for listening to Boston Children's Answers Parentcast. And a special thanks to our guest expert, Dr. Pamela Murray, and our guest parent, Heidi. If you're interested in learning more about adolescent medicine or other podcasts, please check us out at bostonchildrens.org. Until next time, take care and be well.